Thank you, Nevin. Hi, I'm Zara Rothenberg. I'm licensed by the state of California, and I'm certified by multiple insurance companies. Today, we're going to talk about Medicare basics. And what is important about basic and what you need to know? The topics we are going to cover is when you become eligible for Medicare. Then we go over your choices when it comes to Medicare. We talk about different parts of Medicare, Part A, Part B, Part C. We briefly talk about Medigap, which is known as the supplement plan. Then we go over the prescription drug, the drug tiers, the stages of drug. And finally, at the end, we briefly talk about extra help with prescription drug. As Nevin mentioned throughout the presentation, I'm going to stop a couple times to see if you have any questions. And then at the end, we also allocate some time for any questions that you have. If your questions is really specific to you, I would appreciate it if you wait at the very end to talk to me about it so I can answer it. But if your question is general, please go ahead and ask throughout the presentation. Okay, eligibility criteria. You become eligible for Medicare when you turn 65. And in some cases, if you're younger than 65, if you have some disability, then you may qualify for Medicare. You have to be a U.S. citizen or at least a U.S. resident for 5 consecutive years. Now, the criteria that makes you you sign up for Medicare, the very first one we cover is called initial enrollment period. The initial enrollment period is when you turn 65 or for the first time you become eligible for Medicare. Then you would have 3 months before the month of your birthday, the month of your birthday, and 3 months after the month of your birthday. So the total of 7 months you have to sign up for Medicare. For example, if your birthday is, let's say, July 15, you have from April 1st until October 31st to sign up for Medicare. Should you sign up in April, May, or June, then the starting date for your Medicare would be July 1st. Your Medicare always starts the first of the month, regardless of what day of the month your birthday is. So if you apply April, May, and June, your start date for your Medicare would be July 1st. But if you apply in July, then your Medicare start date would be September 1st. If you apply in September, then it would be October 1st, so on and so forth. So you have 7 months to sign up. Also, this applies when later we talked about Medicare Advantage or prescription drug. Then at that time, once you get your Medicare card, you can apply for Medicare Advantage or prescription drug. The next eligibility is the green area. It's called annual enrollment period. Annual enrollment period starts from October 15 through December 7th. This is the time for those who are already on Medicare. If they wanted to change their plan or the company they're with, once a year, they have the opportunity to make that change. If you change your plan during this period, your effective date for your new plan would be January 1st of the following year. The next one is the light blue one. It's called open enrollment period. Open enrollment period is from January 1st through March 31st. This gives an opportunity to those who are already on Medicare Advantage plan to change their plan from one company to another or from one plan to another. So they get a second chance to change their Medicare Advantage or drop their Medicare Advantage, go back to the original Medicare. And finally, the last enrollment period is a special enrollment period, which is the dark blue one. The dark blue one could be any time of the year. However, you need to have a qualifying event in order to qualify for a special enrollment. The qualifying event, for example, could be if you retired, you're working, all of a sudden, middle of the year, you decide to retire, then you qualify to join Medicare or Advantage plan. If you move out of area, you qualify. If you start receiving or dropping your Medi-Cal or extra help with prescription drug, then you qualify for special enrollment. If you qualify based on disability for some chronic illnesses, you qualify for a special enrollment. Now, these are not the only qualification. There are many others, but these are some examples. So basically, you have to see where you fall in. If you're new to Medicare, obviously you would go to the initial enrollment. If you're already with Medicare, you want to change, you would go to the annual. And then the open enrollment is an extra period that allows you to change your Advantage. And then there is a special enrollment. So those are the times you can sign on. Now let's talk about what is Medicare. Medicare consists of Part A and Part B. Combined is known as original Medicare. If somebody says, I have original Medicare, they're basically saying, I only have A and B. Part A is for inpatient hospital, which means you have to get admitted to the hospital. Part A, if you are entitled, if you have paid your Social Security and Medicare taxes for 40 quarters, which is 10 years, then you are entitled to your Part A. Part A covers 100% of the cost. It has a zero premium if you have paid your taxes, but it has a large deductible. Part B, however, on the other hand, covers outpatient hospital, doctor visit, any lab work. Part B only covers 80%. It's not 100% like Part A. Part B does have a premium, and the premium is based on your income, and then it has a small deductible. Now, later on, I'm giving you some amounts to tell you what is the deductible and what is the premium. So when you sign up for original Medicare, you're going to get your Medicare card, which is, some people refer to it by red, white, and blue card. On your Medicare card, you'll see your name, your Medicare number, and you see an effective date for your Part A and Part B. If you apply for your Part A and B at the same time, obviously the effective date would be the same. But if you apply for them at a different time, for example, when you turn 65, you're still working, you may choose to apply for Part A because Part A doesn't have a premium. You may say, okay, I'm just going to go get Part A and have it. And then wait a few years later, once you retired, then you will apply for Part B. In that case, then the effective date for A and B obviously would be a different date. So original Medicare combined gives you a lot of benefit. However, it doesn't give you 100% benefit because Part A has a large deductible. Part B only covers 80%. And combined, they do not cover prescription drug. So most people, once they get their original Medicare card, they go to private insurance companies to get additional insurance to complement a complete coverage for your health. Oops. So once it comes going to a private insurance company, you basically have two options. Option one, you can apply for a supplement plan, which is also known as Medigap. The supplement plan basically fills in the gap that Medicare, original Medicare does not cover. So it covers your large deductible for Part A, and it also covers the 20% for Part B. However, it does not give you prescription drug. So if you go with option 1, after you get your Medigap card, you have to get a standalone prescription drug because you have to have a drug coverage. So in this case, you carry 3 cards with you. You would carry your Medicare card for the Medicare benefits. Then you carry your supplement card for the gap that Medicare does not cover. And then you would carry your prescription drug card. So that would be one complete coverage. The other option is option 2, which is known as Advantage or Part C. Sometimes in 1990s, Medicare realized that they're spending a lot of money on administrative and processing claims, and they decided to make contract with private insurance company such that Medicare pays certain amount of money for each individual who is on Medicare to the private insurance company. And then each private insurance company would take care of all your medical processing and claims and everything like that. In this case, you don't lose the benefits that you had under original Medicare. All those benefits are embedded in your Advantage. But in addition to that, you get the coverage for the, the Part A deductible and the 20% for Part B. And in addition to that, the Advantage plan gives you the prescription drug. So that's part of the plan. It's not a separate standalone like option 1. So you get the prescription drug, and some give you other benefits. They may give you like allowance for over-the-counter prescription, or depending what plan you signed up, they may give you some rides to your doctors or pharmacy. So basically, with this plan, you only carry 1 card with you because you only need your Advantage plan card. Now, for each of these options, there are advantages and disadvantages. With the option 1 supplement plan, the advantage is flexibility, because this plan allows you to go to any doctors, any hospital, anywhere in the whole US, as long as they accept Medicare. Now, this is very important, as long as they accept Medicare, because not every hospital or every doctor accepts Medicare. You cannot assume, well, everybody accepts Medicare, I'm going to go to this doctor. You need to ask them, do you accept Medicare? So that's a good advantage, is a flexibility. The disadvantage is with the option 1, your premium goes up by your age. Usually 3 to 6% increase is every year. As you get older, like let's say you get to your late 70s or 80s, you'll be paying a good chunk of money for your premium because it keeps on going up. And the other disadvantage is it does not include prescription drugs. So you have to pay another premium to sign up for a prescription drug. When it comes to option 2, the disadvantage of option 2, which is also known as Part C, is you belong to a network. If your plan is an HMO plan, you cannot go out of your network. If your plan is a PPO plan, then you can go out of network, but it could be at an additional cost. The advantage of this plan is your premium does not go up by your age. And generally, in each county, there are plans with 0 premium. So you basically pay 0 amount and get all this benefit in addition to your Medicare Part A and B. So this is very attractive to some people. And in addition to that, it gives you prescription drug and it gives you other benefits. So at this point, when I talk to my clients, they all ask me, well, Zaro, which one do you think is better? And my answer always is, well, it depends. It really depends on the individual and your situation. If you have a situation that you think you want to go to multiple medical centers and you need the second opinions and you need to have the flexibility, then it's probably worth it to pay the extra and have a supplement plan. On the other hand, if you go to one medical group, let's say if you go to Palo Alto Medical Foundation and all your doctors and all your tests and everything is done in that center, you may want to think, well, what am I paying so much for a supplement plan? I can stay with an Advantage plan and take care of all my business the way I have been doing it and not pay the extra. So it really depends on the individual situation and how much you want to pay. And when I meet with my clients, is really I get into detail to find out what's important to them and which plan would benefit them more. So Nevin, at this point, I'm going to stop and see if they have, I covered a lot of information to see if anybody has any question.
Let me see. I don't see any question in Q&A box.
Okay, so we move on, but I'm going to stop again. If you think of something, please type it into the chat box.
Yes, I would
Or
like to
maybe
remind them, Zara, if you type your question in Q&A box
or
on
Q&A
on
box.
the bottom of your screen, so it will be easier for us to see all the questions in order.
Okay,
Thank you.
okay, we move on. Now I'm going to give you some more detail about different parts of Medicare and give you some amounts. So again, you're eligible for Medicare when you turn 65. In some cases, on basis of disability, you may qualify for Medicare even if you're younger than 65. If you have end-stage renal disease, which is like kidney dialysis or ALS, you qualify for Medicare even though you're not 65. You have to be a U.S. citizen or a legal residents who have lived in U.S. for at least 5 consecutive years. Then you qualify for Medicare. Now, Medicare Part A, as I say, is for inpatient hospital. You have to get admitted to the hospital. It has a 0 premium. However, it has a large deductible. For the first 60 days, if you stay in the hospital, you have to pay $1,632. Now, these amounts are for 2024. As every year changes, these deductibles change. So the first 60 days, you pay $1,632. And then if you have to stay there an additional 30 days, day 61 to 90, you pay $408 per day. And then in addition to that, they give you another 60-day lifetime, which can be used throughout any year at $816 per day. So this is after you use your 90 days, then your 60-day lifetime would kick in. So inpatient Part A also covers inpatient skilled nursing. It pays the first 20 days. And then after that, you pay $204 per day for day 21 through 100. It covers the rehabilitation facility, it covers home health care, and it covers hospice care. Part B is for outpatient services, is for your doctor visit, for any work you get done in a lab. And Now, outpatient, keep in mind, if you, let's say, have a surgery in the hospital in the morning and they send you home at night, that is called outpatient. It's not the inpatient because you did not spend the night in the hospital. So this covers home health care. It covers durable medical equipment. Durable medical equipment are like a special bed, wheelchair. Even if you're on a CPAP machine, that's considered durable medical equipment. And it covers some of the preventative services. Now, when you sign up for the Advantage, then it covers a lot more preventative services. So this is Part B. As I mentioned to you, Part B only covers 80% of the allowed amount. Part B has a premium of $174.70 in 2024. This is the base premium that they charge, but they would look at your income. If you collect Social Security, this $174.70 is automatically deducted from your Social Security. They don't even ask you. But if you don't collect Social Security, then they bill you for the $174.70. Now, this is the base premium, and they look at your MAGI, modified adjusted gross income, when you file your taxes. If you file as a single, if your income is up to $103,000, and if you file joint, if your income is up to $206,000, then you pay the $174.70. But if your income is higher than this threshold, then you would have to pay additional amount for your Part B premium. And how much is the additional amount is based on how much more you made above this threshold amounts. And then the Part B also has a small deductible of $240 in 2024. Again, these numbers change every year. This is for 2024. Now, one thing that is extremely important for your Part B is if you are eligible for Part B and you do not have coverage under any other insurance, in other words, you're not working, your employer is not, you're not covered under your employer insurance or under your spouse's employer insurance, and you turn 65 and you decide not to sign up for Part B, you may say, well, I'm really healthy. I don't even go and see a doctor. Why do I want to pay, $174 or maybe even more to get this insurance? Well, it doesn't work that way. If you turn 65 and if you do not have any other what they call creditable insurance, then you're subject to a penalty. And the penalty is 10% per year. And that would be for the rest of your life or as long as you are applying for Part B. It's not just for the year you didn't pay or for 3 years. That is assessed for the rest of your life. And the reason they do that is because they want people when they turn 65 to join Part B and not wait until they get sick. Now, I use the term creditable insurance. Creditable insurance is an insurance which is at least as good as what Medicare offers. So if you have employer insurance, depending how big your company is, you have to check and see is your insurance creditable. And most employer insurance are creditable, so you should be okay. Moving on. Medicare Part C, which is the Advantage plan. Again, as I mentioned to you, Medicare made contract with private insurance companies such that private insurance company would take care of your medical claims and administrative costs. And it includes all the benefits you had under A and B. You don't lose anything. Everything is embedded in your Part C. And it usually gives you Part D, which is for your prescription drug with the same plan. And many plans include additional benefits. Depending on the plan, you get additional benefits. And the premium and deductible, the premium you pay for your Part C and your deductible is based on the insurance company, the plan you're signing up for, and also in the county where you reside. So the Part C plan, Advantage plan, it really goes by the county where you reside. So if you live in Santa Clara County, there are certain plans offered to the residents of Santa Clara. And if you move, let's say, to San Mateo County, then there's going to be different plans available for you in San Mateo County. So moving on, the only thing you need to have to qualify for Part C, you need to be eligible and sign up for your Part A and B, and you have to live in the plan service area, which is again is the county. So if you apply for a plan in Santa Clara County, you have to live in Santa Clara County. There is no pre-existing condition. They don't ask you for any medical questions in order to sign up for a Part C plan. Okay, now I'm briefly going to talk about Medigap, which is the option 1. Now, prescription drug and the Part C Advantage plan is overlooked by Medicare. Therefore, Medicare wants us to really explain what Part Advantage plan and prescription drug plan is about. They don't overlook the supplement plan. The supplement plan is overlooked by Department of Insurance. So Medicare didn't even require that for me to put this slide in this presentation. But since I tell you about option 1, I felt it's important to add this and give you some information about it. So Medicare supplement is provided by private insurance company. You have 6 months from the time that you get your Part B to sign up for a supplement plan. After that, then you may be subject to penalty. It allows you to go to any doctor, any hospital, anywhere in the whole US, as long as they accept Medicare. Again, I'm going to emphasize, as long as they accept Medicare. And then the premium increases by your age, and it does not cover prescription drug. You have to get a standalone prescription drug with this plan. Okay, before I start the Part D, any questions?
Yes. If my birth is March next year, which month should I apply Medicare Part B?
March 2025, so you have 3 months. You can start from December 1st of 2024. You can apply for your Medicare Part A and B, and once you get your Medicare card, then you can apply for either a supplement plan or an Advantage plan.
Thank you. That was the only question.
Okay, we move on. So prescription drug is whether you get your prescription drug through a standalone plan or as part of your Advantage plan, whatever I explained to you applies. Okay, it's the same. So it's prescription drug is provided by private insurance companies, and it helps you to lower your cost, because when you sign up for a plan, that would be the cost of the plan and the drug for the rest of the year. So if there is a increase in the middle of the year, then you're safe. You have already signed up for the plan. And the premium would vary depending on the plan. Obviously, if it's offered as part of your Advantage plan, you don't pay for it. But if it's a standalone plan, you have to pay a premium depending on the plan. And the deductible could vary. It could be from $0 to $545 per year in 2024. So if some plan, if you get an Advantage plan, they may say no deductible for your drugs, or they may say only $280 deductible. You have to be careful when you sign up. So at this point, let me give you some terminology, because when I say deductible, that means once a year. That means you meet your deductible, you're done for the rest of the year. When I say premium, like when I say you pay so much for your Part B or so much for the Advantage plan, the premium is per month. Every month you have to pay your premium for the plan. Later on in the prescription drug, I'm going to talk about copay. When I say copay is per usage. For example, if you have to pay $3 copay for every month for your drugs, it's only if you buy the drugs you pay $3. If you don't use any drugs the whole year, you're not going to have any copay. So that's the terminology. So we move on with the drugs. The drugs, also just like your Part B, that you have 10% penalty for not getting the Part B if you were eligible and didn't have any other insurance. Part D also is subject to late enrollment penalty. The penalty, if you don't have any insurance for 63 days in a row after your initial enrollment period, after you turn 65 or any period that you qualify for initial enrollment, if for more than 63 days you don't have any prescription drug insurance, you're subject to penalty. And the penalty is 1% per month, which is really 12% per year, but they count it per month. So if you are 5 months late, it would be 5%. And is added to the national average premium for prescription drug, which is now around like about $35 a month for national average of a plan, the prescription drug plan. So again, this is added. You may say, I don't take any drugs at all. Why do I need a prescription drug? Well, it doesn't work that way, just like Part B. If you ever need to apply for a prescription drug, they count and see how many days you were eligible to have a drug and you did not have an employer plan or a spouse's employer plan and you did not have a creditable insurance. And therefore you're subject to 1% per month, and they assess that to you for the rest of your life, not just how many months you missed it. Very, very important. That's why it's important to talk to somebody to help you to determine what your situation is, so that you're not subject to penalty. Okay, now I'm going to talk about the drug tiers. Now, again, this is an example. This doesn't mean the amounts I'm giving you are the real amounts. It's just an example. I'm making an example so I can demonstrate how the copay and tier works. So each drug plan, whether it's offered through a Advantage plan or whether it's the standalone, each company would determine how they want to set up their drugs. And they classify their drugs into 5 classifications. Some have 6 classifications. They call it tier. Tier 1 and Tier 2 are generic drugs. Tier 3 and Tier 4 are brand drugs. And Tier 5 is a specialty drugs, like chemotherapy, very expensive drugs. And then some company have picked up some drugs from Tier 1 and Tier 2 that is very commonly used, like a high blood pressure or high cholesterol drugs, and they formed a 6th tier. They call it Tier 6. Some don't have the Tier 6. They just leave it in Tier 1 and Tier 2. So the lower the tier, the cheaper the drug. So, and this is an example. So if, for example, if your drug is Tier 1, let's say the cost of your drug is $50. if you have insurance, depending on your plan, you may have to pay $0 or you may have to pay $1 or $2, depending on the plan. So you pay your copay, oops, and then insurance company pays the rest. So because you have insurance, you don't pay the full price for the drugs. The insurance company helps you. And let's say if your drug is tier 2 and it costs $90, you pay your copay, in this example, $3, and insurance company pays for the rest. So it really helps you what the tier it is. Again, the lower the tier, the cheaper the drug. Now, in addition to the tier, prescription drug also have what they call stages of drug. The stages of drug are basically 3 stages. But before we start with the first stage, we have an annual deductible. So if your plan has a deductible, you have to meet your deductible before the plan starts paying for your drugs. If your plan does not have a deductible, for example, a lot of tier 1 or drugs don't have a deductible. So if all your drugs are tier 1, so starting with January 1st, you start with initial coverage phase, which means you pay your copay and the insurance company pays the rest. So in our example, previous page, that in initial coverage phase, if you had a tier 1, in this example, if the drug was $50, you pay your $1, insurance pays the $49. So you stay in the initial coverage phase, January, February, March, April, as you fill your prescription, or if you fill it up every 3 months, you are in initial phase coverage until the total cost of your drugs reaches $5,030. Now, these are for 2024. This number changes every year. So as you fill your prescription, to the extent that the total cost is below $5,030 cumulatively, you stay in initial coverage. You don't go anywhere. You don't pay any additional. You know, it just is below $5,030. If for some reason you have drugs that are more expensive and you go over $5,030, then you move to the next phase, which is called coverage gap, or some refer to it as donut hole. So if you fall into coverage gap, you pay 25% the cost of your generic and 25% cost of your brand drugs. And the pharmaceutical company, the drug manufacturer, pays the rest. Now, if you fall into coverage gap, the 25% could be a lot higher than your copay of $1, $3, or $10. So if you fall into coverage gap at any month, all of a sudden you're going to realize that your monthly drug cost has increased because you reached the coverage gap. You stay in coverage gap until the total out of pocket reaches $8,000. Now, total out of pocket is what you pay and what a drug manufacturer pays, but it does not include what insurance company pays. So you stay in the coverage gap until you get to 8,000. If you go over 8,000, you move to the last phase, which is catastrophic. In the catastrophic, insurance company comes back in here and helps you to pay the cost of, if your drug is covered by the insurance company, they fully pay for it. If your drug is not covered by, if you're using a drug that's not covered by the plan, then you would have to pay for the cost of your drugs, even though you're in catastrophic. So basically, insurance company helps you with initial coverage, and it helps you with catastrophic coverage, but it does not help you with the coverage gap. So you are on your own, and the drug manufacturer helps you. So the message here is keep your drugs generic. because if you keep your drugs generic, it's very likely you're not going to reach 5,000 and you don't need to deal with coverage gap or catastrophic. You just stay in this phase and you pay a few dollars for your drugs, then you're happy. But should you end up with some drugs that are tier 3, tier 4, tier 5, then you can't help it. You're forced to go to coverage gap, and then eventually you go to catastrophic. So basically, it's important to know where you stand. When I talk to my clients, I usually ask them to send me the list of your drugs so that I can look them up and tell them what tier they are. Also tell them what's the likelihood of they fall into the coverage gap, so they get some idea and compare different plans so they can see which one they get better pricing. So here I'm going to talk about some definitions. So if you hear about it, I want to make sure that you understand what it means. Pharmacy network, each plan has their own preferred pharmacy, or they may have multiple pharmacy that is preferred under the plan. So if you go to those pharmacies, you get better pricing for that plan. But if it allows you to go out to different pharmacy, but you may have to pay more. Drug formulary is a list of all the drugs. Usually you can access it online, is better because they keep on adding drugs and is more up to date. Otherwise, when they send you the booklet, when you sign up, it has the formularies listed, list of your drugs alphabetically, and after the drug name, it always says a T, a number. That would be the tier. It tells you what tier that drug is. Tiered formulary, we talked about it, the different tier of the drugs. Step therapy is when they want to go to a brand drug, the plan requires that you at least try the generic drug first before you go to the brand. Unless your doctor says, well, the generic doesn't work for you and you have to take the brand drugs. In that case, your doctor would submit a form to the plan and the plan would review it and approve it. Quantity limit, usually there is a number of pills you have to take per day. If for some reason you have to take, instead of 1 a day, you have to take 3 a day, again, your doctor has to submit a form to the plan, and upon review, plan would approve it that you can take 3 a day. Prior authorization is a drug is not covered by the plan. Your doctor can submit a prior authorization to the plan so that the plan would provide you the drug. Again, if the plan is not covered by the company, if your drug is not covered by the plan, you would have to pay the cost of the drug. The insurance company is not going to help you. And the coverage decision, if it's an emergency, they usually, after your doctor submits the form within 72 hours, the plan would review it and approve your drugs. Okay, and then finally, we're going to go over extra help with prescription drugs. Some people, their income is above the Medi-Cal threshold, but they still do not make the significant amount. So there is a plan offered by each state that if your annual income for an individual is below $21,870, these are for 2024, and for a joint couple, $29,580, then you may qualify for extra help. They also look at your resources. If your resources for an individual is below 16,600, for a couple 33,240, then you qualify for extra help. Now the resources is like your bank account, your stocks and bonds. It does not include the home where you reside or one car where you when you travel around. If you qualify for extra help, this may help you in the coverage gap. So if you have a drug that falls into the gap, then the state under this extra help plan would help you. And also it may help you depending what your situation is with some of your premium that you have to pay for your drugs. So and finally, this is the information about me, about all the companies I represent. So I'm going to stop at this point and see if you have any questions. But before I do that, I just want to let you know, if you have any questions or if you were shy to bring up your situation and ask me specifically, give me a call after the seminar. Talking to me and discussing your situation with me, it's not going to cost you anything. Discussing with me is free. No matter how many times we talk, and the way I get compensated, if you sign up for a plan, the insurance company compensates me. So you don't have to pay a penny. So don't be shy. Give me a call, ask me questions, or if you forget something now and you want to ask questions, this is my information. You may want to take a picture of this page and give me a call. Don't be shy. So Nevin, we all done. Let's see if they have any questions.
Thank you, Zara. Thank you for the great presentation. Let's give our attendees some time to type their questions. In the meantime, I would like to mention this session is being recorded and will be shared with you all after the webinar today or tomorrow, and also will be posted on our YouTube channel for later view. And someone asked if we can share the presentation slides. Unfortunately, we cannot. The Medicare doesn't allow us to do that. They only have their information on their website. But this session, again, the recording will be shared. And if you have any questions, please type them in Q&A box. So I know it's a lot of information. Just let us know. We will be here for a while to see. In the meantime, would you like to cover anything else, Zara?
No, basically, I mean, one advice is do not share your personal information or your Medicare cards or something with anybody unless you trust them. You know, either they are qualified, certified agent. It's your own personal information that for safety purposes. And the other thing I want to mention is, it's always good to discuss and have a broker or somebody that you trust that you can go to and ask information. Let somebody help you because you're not paying for their services. So don't be shy. Say, well, I know how to do it myself. I'm going to go online and I'm going to do it. And, most likely you achieve and you can do it. But if you can get help, ask for help. And then finally, as Nevin mentioned, please give us feedback as to what area you like to see more emphasized and get more in depth, because this is a very general information. Medicare is a lot more complicated depending what your situation is. So give us feedback so we can cover those in the future webinar.
Thank you. Yes. And Zara, you mentioned in the beginning of the webinar, if you are a citizen or if you have a green card but live in the US for 5 years, that they can apply?
Yeah, if you are a legal resident for 5 consecutive years.
Consecutive years, okay.
Yes. And of course, you have to pay your taxes. It's not, you have to have work in order to qualify for Medicare. You have to have work for what they go by quarter, 40 quarters, which is equivalent to 10 years, and paid your taxes. Now, if you have only worked, let's say, for 30 quarters, there are plans that they gives you Medicare. However, the Part A is not free anymore because you have not worked your 40 quarters. They would look at the scale and the schedule and say, okay, for your Part A, you have to pay so much. For your Part B, you have to pay so much.
I see. And also, can you please remind us how does Medicare work if they travel abroad?
Okay, if you travel abroad, whether you have a supplement plan or whether you have an advantage plan, an emergency situation is covered. Emergency means if it's a life-threatening or if it's something that needs immediate attention. For example, God forbid, if you get into a car accident and somebody's leg breaks, it needs immediate attention, even though it's not life-threatening. So in that case, you pay for your medical bills, and then you bring your invoices and you submit to the insurance company to reimburse you. But be very careful, because when they say insurance emergency, it really has to be emergency. They really scrutinize it. And when you come back, they may say, no, this wasn't an emergency. You didn't, you don't have to go to the hospital or take care of it. So you got to be careful. But both plans do have emergency coverage to certain amount, not unlimited, depending on the plan you sign up. Again, if you have a specific plan in mind, then we can look it up for you and say specifically how much is covered for those who travel a lot.
Thank you. And we have one question here. Can I apply Part B on January next year and I was born in March? Why we need 3 months to apply? I think there's a misunderstanding in this part.
Okay, so if you turn 65 in March, it doesn't mean you have to apply in January 1st. However, Medicare is giving you 7 months window to sign up, because some people, they living their life, they turning 65, they don't even realize they qualify for Medicare. And then later on, they realize, oh, they missed the window and opportunity to sign up. So they give you plenty of time, 7 months. But that doesn't mean you have to go and apply in January. You can apply in February, March, April, May, June, July. So you have plenty of time to sign up. You don't have to. It's just they give you enough time to sign up.
Thank you. So what happens if they miss that 7 months?
If they miss up 7 months, then they're subject to a penalty. They have to wait for the enrollment period, and then they find out how many months they were supposed to sign up and they didn't, then they're subject to penalty.
Oh, I see. How long does it take to process the application for Medicare?
Well, before COVID, it was really like a week to 2 weeks, but now it could take up to sometimes a month. So that's another reason, if your birthday is in March, to apply in January or February, because it could take up to a month for you to get your Medicare card. And also, if for some reason after 3 weeks you haven't heard from Medicare, it doesn't hurt to give them a call to follow up, to see, maybe there was something wrong with your application. And, they send you a message saying complete this and you didn't. So you have to be proactive and be on top of it. Now, any questions you have with Medicare, you have to call Medicare. Us brokers cannot help you because we cannot represent you as far as Medicare is concerned unless you're on the phone with us. So we cannot ask questions because we don't have power of attorney to represent you. So you have to be on top of it. If your name is misspelled on your card, you need to call them back and have them corrected. So it's up to you to do it. But anything to do with your supplement plan or advantage plan, then you can call us, and if something is wrong, we can help you to resolve the issue.
Thank you. And also, like you mentioned, and there's a lot of information here to decide what plan they need to apply. So it also takes time to do their research, right?
Yes.
And then when they do their research, they decide to apply. So let's say they applied this month, and it takes about up to 1 month. During that month, if something happens, they receive big medical bill, the Medicare takes that application date as a starting date?
Not if you have not applied and got your Medicare. Let's say your birthday is, let's say, is in June, and you just applied to get your Medicare card, but it's being processed, and all of a sudden you incur a big cost. But you're not eligible for Medicare until June anyway. So they're not going to retroactively pay for your costs.
I see.
You just have to get your Medicare card, which is effective June 1st, and then starting June 1st, they would cover for your bills.
I see. Thank you. One more question. I heard now we apply online, not in-person appointment. Is that correct?
Yes, yes. I mean, you could walk into your Medicare and Social Security have the same office, and each county have their own Social Security office. So if you're not very savvy with computer, or you're not sure of the questions they ask you online, you can walk and either call them and make an appointment, or even walk in and take a number and wait. And then when talk to them and said, well, I filled it, my application this far, and I have a question, I got stuck, then they help you. They help you to fill it up and submit it.
Thank you. Really good information. So let's wait 5 more minutes.
Okay.
We'll be here, and then if there is no question, we will say goodbye. Thanks again for joining us today. And thank you, Zara.
Oh, you're welcome.
It's very helpful. Probably we are going to have one more session in
October. Yeah.
Yes, because October is
the annual enrollment.
Oh, I
Because,
see.
it's very busy time, because right now only people who are turning 65 or they have moved, they're interested to see what Medicare is about. But annual enrollment, the whole senior population who are on Medicare, they're interested to know what new plans have come, because every year new plans come to market, or some plans are being eliminated. So it's important right at annual enrollment to be on top of your Medicare and see what else is new, what's going on with my county.
Yes, that's also good to know,
Mhm.
that date. Do they need to work with a broker to be able
No,
to do that?
no. If they are savvy enough, they can go to a website and talk to a broker. But if they have a questions or something happens, if they don't have a broker of record, then they cannot call a broker and say, oh, I got stuck, I messed up, and I have a problem. Then the broker cannot help you. And I strongly suggest, since there's no cost to you to get a broker involved, ask a broker for help, because it's not going to cost you.
In case they miss something.
They miss something, or in the future you have questions, or you want to know,
Yes. Yes. Okay. Thank you all for attending the webinar, and thank you, Zara.
Thank you, Nevan, for your help. I appreciate it.
Of course. And have a nice afternoon, day. Hope to see you in another event. Bye.
Yes. Bye.